Okay, so hi everyone. So my name is Liana Adrung, and I am the administrative coordinator for the Monsignor Dega Association and Monsignor American Organization. First, I wanted to let you all know that we're going to be recording this meeting just for resources purposes and for minute purposes, so we don't have to be typing while listening or looking at each other. Second, we want to say thank you for taking your time to join us this evening. And also, we would like to express our sincere thanks to all of our other agency supporters, volunteers, intern, community supporter, and also to all of our donors for this year. Without you guys supporting us, we would not be able to do the work that we do. So we just want to say thank you so much for that. Okay, so this is our agenda for today. Welcome by me, and then we're going to go around and introduce ourselves. We usually do it by doing popcorn style, and just say your name, your agencies. You can share your pronoun if you're comfortable. If not, it's okay. And then we're going to hear an update from our organization by Ha, and then we're going to hear from our community speaker for today. And then we're going to move into community updates or other agency updates. And then we'll have question and answering session. And then we'll finish, after we leave the space for an hour and a half today. So hopefully we will get through that. And we will just kind of see who the audience is, and just to see if we need to do interpretation. If not, most of our speakers are bilingual, so I'm hoping that they can interpret themselves. If not, it's okay. Well, me and Ha are here to help. All right, so next I will pass the mic to Ha for an update.
Thank you, Liana. Hello, everyone again. My name is Ha Tong, if you missed that in the beginning, and I am the community liaison at MDA, Monsignor Dega Association. And I would like to briefly update everyone on what we have done and what we are currently doing, and as well as our upcoming programs. So I'll begin with our previous programs. I know I already mentioned this number, but I would like to mention this number again to you all. So in the month of April, May, and June, we served 187 families, which equal to 858 people. And from the month of July to September, we served 234 families, which equal to 878 people. So for a total for 6 months, we served 421 families, 1,736 people. That is a really big number. And we would not be able to serve this many people without our partners' help and volunteers. So thank you all for your hard work, energy, and time. And for Thanksgiving, we were able to share Thanksgiving meals with 21 families. And again, on behalf of MDA, I would like to thank our partners, volunteers, and donors. Without you all, we will not be able to bring warm foods to these families. So if you're interested in looking at the picture of this family that received our food basket and also the process of the whole event, please check out our post on our Facebook page. We made sure that we ask permission from this family before taking the pictures and posting online. I know some of you already emailed me and asking for pictures. Apparently, it's kind of difficult for me to share on email. So if you could just go to our Facebook page, it's much faster and easier if you would like to download the picture and share with the donor or the agency that you're with. For our future and current programs, we will also do one food drive for Christmas. And thank you, Dr. and your team for this opportunity to serve both Bhutanese and also Marnyao communities. So we talked this past Wednesday. So due to cultural preferences of the two communities, we decided to do two separate food drives. One is for the Marnyao community, which will happen on Tuesday, December the 22nd, this coming Tuesday. And the other one is for the Bhutanese community, It will be on Saturday, December the 26th. And we're looking to serve at least 36 families. And we do need volunteer for each of these events. So if you have time or know anyone that may be interested to help us, please let us know. We would appreciate that a lot. And I still have some spot left. So if you know any families that need help with food, let us know. And all we need is their name, phone number, and address to make it easier for us to plan and also for delivery if they cannot come and pick up the food themselves. I also would like to thank Pastor Susan from Guilford College United Methodist Church for helping us sponsoring 2 families that are really in need with gift, some warm clothes, shoes, toys, and especially food. And I also would like to thank my small group for coordinating the shopping and delivery. It's been very wonderful sharing with you all about this good news. For employment-related services, we are still serving people under 5 and over 5. So if you are not with this term, which means we're serving people that have been in the United States for 5 and below, for 5 years and below, and also above 5 years. Andrew is our part-time employment specialist, and he has been very active with helping people with resume and college application, especially with young people. And so if you come across anyone that would like to improve their resume, please bring them to Andrew. Andrew, thank you so much for your heart. I know you care a lot about young people. For COVID-related services, we are still helping community members with testing, quarantine, and isolation, and also referrals. If anyone need help with rents and utility, we can also refer them to other agency and help them to get resources that are available. Later on, some of our community speakers will share more about these agency and also the resources that are available at their agencies. Due to COVID, we could not have in-person English and also our citizenship classes. But I am so excited to let you all know that next year we'll have our touring programs, which will be in person, and we will try our best to make sure it's safe for everybody. However, our English class and our citizenship class will be online, will be on Zoom. We need volunteers, we need tutors, we need teachers, so please help us spread the words. I know it will be really difficult for community members to work with technology, but I believe that we can do it. And this will be a challenge for us. And I think it is really important that we learn to adapt to the changes, to the newness. And if you haven't realized yet, this is our last community meeting for 2020. I'm so excited that we almost done with 2020. It has been a very difficult year, but I saw a lot of changes and growth. I've seen more and more young people being in different places, serving our community in different areas. And I am very proud of you. Thank you all for your time, energy, and dedication. Thank you all.
Thank you, Ha.
If I miss anything, Liana, you're welcome to add, or Stephanie.
Okay, sounds good. Thank you. So we're going to move to our community speakers. Sel, she would like to go first because she wants to do a screen share. Since we don't have any anyone in here that need an interpretation, so we're just going to keep everything in English and continue with our meeting. Sel, I make you co-host or a host. If you could keep an eye on the side area. If someone come in, you can let them in. Thank you.
Okay.
And
yes, you're welcome. Thank you so much, Liana and Ha, for those updates on what's going on in the community and how MDA has stepped up to provide those necessary supports during these times. One of the most, can everyone see my screen okay?
Yes.
Let me let someone, I think someone is in the waiting room. Okay, I think that was a chat. I wanted to share our website. So this is the Greensboro Housing Coalition, and it is one of the nonprofit agencies that is assisting with rent and utilities assistance during this time. And so to go, you can go on this website by entering greensborohousingcoalition.org. And I wanted to make sure that when you do go on the website, you know where to find and locate information. And above here is our number, 336-691-9521. And so right here is where you will find our office updates and just our precautions and how we protect our staff and also the people who come in as well. This was at the very beginning of COVID. And so we have housing counseling programs, we have homeless rental and assistance, and home ownership programs. And I work with the Collaborative Cottage Grove, which is an initiative of our agency where we do a lot of our community engagement work like I am today. And so the most important part is, where do you find the application? And so you can click on this box right here. And this talks about the COVID-19 program that we have, which can be up to a combined amount of $1,900 to assist with rent and utilities. And all right, and so you'll get to this page right here. And so these are our instructions on how people can submit their application. And so there are 3 options that people can pick from. We also understand that not everyone has access to a printer, a fax machine, and things as such. And so what they can do if that doesn't work out is that they can call the Greensboro Housing Coalition. Make sure that when they do call, to leave a detailed message with their name and contact information. If they keep calling multiple times, that will cause a lot of that will cause a great volume of people that we have to call back. So we encourage them to call at least once a week if possible, because we've been getting a lot of calls, and leave a detailed message, and a housing counselor can help them fill out the application over the phone. And our third option is where they can come to our office, which is open from 8:30 to 4:30 p.m. And these are our hours have fluctuated because of COVID. You can find us at Summit Avenue, and our address is up here. So we do have a drop box. If, for example, you are working with someone and they've already filled out their application, put it in an envelope, write their name down, make sure that it says Dropbox, because that's where they are placing it and how they're submitting the application, and have a date clearly on it. Because one of my roles and how I'm assisting GHC is tracking each application. That way people feel confident that their applications are being tracked, and that we are touching every single application that comes through our door, when people are needing assistance of rent and utilities. And so let me go into our flyer. So if you scroll down below here, there's just more general information, what you need to know as a tenant, what you need to know as a landlord. And down here is our application. So our application is fillable, meaning you can fill it out. When you open up the tab, you can save it and send it to our COVID-19 relief email that is specifically for this program. Let me add someone in. And so it's a 7-page application. And if for any reason they can't sign it when they send it, they can, the counselors will work that out. Maybe they can come to the office and just sign that as well. Is there any questions so far? Okay. If not, I will go into our flyer. All right. And so this is just the basic qualifications. Someone has to be within the city of Greensboro city limits. They have to be in their unit from February 2020 or and behind on rent or utilities at least once since April the 1st, 2020. And there has to be also clear proof that they were impacted by COVID-19. For example, they can show proof that their hours were cut due to the shutdowns, and maybe their job wouldn't allow them to come at a certain time, and so their hours were reduced, and that has impacted. But all of these requirements will be discussed with the housing counselor. And so if you are working with someone where you know they have been financially impacted by COVID-19, they can apply for this program. But just be wary that this is for people where they have been explicitly impacted by having COVID, or their hours were impacted and work was impacted and they can't pay rent. And of course, show proof of ID, utility bills, and then a delinquency letter and a notice from your landlord stating that you are behind on rent. And so that is the basis of this program. And you can also find the FAQ here, our frequently asked questions, to answer some of the common questions that we have. So we have at least 2 pages of that. And that covers our program with housing. And I know it's, as of right now, we are one of the other agencies that are doing this. I know Greensboro Urban Ministries is also providing similar resources, as well as the Salvation Army. But because I'm not from the agent, I can't speak on their behalf, but I know that people can also go to them to apply for these assistance. And if you are keeping up with the national news, there is conversations about a second stimulus to potentially help and support those who are renting. I'm just trying to process, making sure I hit all of my points. Yeah, that is what I have so far. And there is an update to where if someone is filed and they have court filings for eviction, they have up until mid-January. I think they are pausing courts from seeing cases such as evictions and forbearance. And so that is also something to consider. And one more thing, if you know of anyone in High Point, because Greensboro Housing Coalition can only serve those who are in the city of Greensboro limits, the housing consultant groups, they help with rent and utilities for High Point only. But for Greensboro, they assist with mortgage. And so if you know of anyone who is struggling to pay for their mortgage, this is also an assistance, and their website, the Housing Consultant Group. But I would just encourage, I know that from our previous community meeting, sorry, it's my dog, from our previous meeting, that was when the CDC moratorium was in place, which was September the 4th. As most of you know, that will expire on December the 31st. And so people in the housing world are panicking a bit, but we're trying to keep a cool head because there's always light at the end of the tunnel. And, when people feel like they can't get to us, let them know that we are trying our absolute best, because this is a crisis where everyone is feeling it across the country. And so it's really intense, and we just encourage people to stay positive and to remain patient as possible. It's really challenging, but we'll get through this. But this is Greensboro Housing Coalition is here to assist in any way we can. We love working with the Monsignor Ortega Association and with their assistance with interpreting when people do come to our office for assistance. But I will leave the room for any questions that you may have related to housing, if I can answer any. And
Soon, would you like to go next?
Yeah, I can go next. I can share a little bit about SEAC for those who I don't have a necessarily PowerPoint, sorry y'all. So this is just gonna be me talking, my bad. If y'all don't know, SEAC is a social justice organization, and we're based in Charlotte, North Carolina. Our base is primarily Black and Brown community members in the east and west side of Charlotte. But we do a lot of statewide work, as I shared. SEAC does some work which includes like youth organizing. We have programs for our youth weekly called Turn Up Tuesdays, and we also have an internship program for youth. We do a lot of immigration / anti-deportation work. What that encompasses is like citizenship fairs and supporting community members and families that are going through deportation proceedings, primarily Southeast Asian folks, so that encompasses Montegnard folks too. And then the program that I'm under is called Community Engagement and Power Building, and that directly is building power in community, primarily through the mechanism of civic engagement work and campaign / policy advocacy. We do a lot of direct actions with local movement families in Charlotte, like Charlotte Uprising and Collectiva, which is a Latinx organization. The summer has been super busy for us, as there has been like a national uprising for folks to really talk about racial justice and standing in solidarity with the movement. So as I share, my work falls in line with the community engagement power building, and we know a lot of folks in this space, luckily, because we're able to build partnerships with MDA, Voices of the Highlands, the Cambodian Cultural Center, and just doing work together to build up capacity of grassroots entity. And so so this election was a pretty big thing for us and was one of the biggest campaign that we've been able to do, like Get Out the Vote campaign. So dropping mailers, door knocking, phone banking, and things like that. I also do want to share that one thing that came up for us during this pandemic has been Operation Backup Rice. So in the Southeast Asian, this came up because in the Southeast Asian community, this pandemic brings up a lot of trauma for folks, and so also realizing that our communities are low income, we decided that community members should never be in a place to be picking whether they should pay the bills or have food on the table. So we did our best to ease that by taking care of each other and grounding ourselves and taking care of our village, which is what we call our community. So we dropped off culturally appropriate food, but also did some wellness check for our community members, obviously social distance. And so we've been doing that in Charlotte, Catawba. And so if y'all know anybody that needs anything in the Charlotte, Catawba area or in Greensboro, I'm more than willing to drop off some things for folks. It's like rice and mama noodles. I do want to share about some of the work that we're doing in Greensboro. As I share, we have some community members, we have some partners, but we also have youth in the Guilford County area and have been doing a lot of we've been doing police accountability work, especially with the murder of Jody Vo. And so that was a big thing for us and some of our youth in Greensboro. And we look forward to continuing doing that work in Greensboro, whatever campaign comes up. So a lot of our work is grounded in the needs of our community. We are currently on a wellness break, or a winter wellness break. So you can definitely reach me soon@seacvillage.org if you have any questions, if you're interested in any of the things I shared. Hopefully that was not a lot of information. If you guys have any questions, please let me know too. Okay, that's just my part.
Thank you for taking the time, even though you're on break, for taking the time to come and talk to us. You know, one of the purpose of the meeting usually, I want people to be able to know, like, okay, if I need housing stuff, who would I go to? Oh, SEL. You know, if I need citizenship stuff, okay, I'm going to go to SOON. I want people to know where they need to go, that we have different Monsignor community members who are bilingual at these different agencies that, you know, who can help them, or they can come here and we can do a referral and stuff like that. So thank you for that. So next on my list, I have Foon.
Everyone, as I mentioned earlier, my name is Foon. And I am a coordinator with Faith Action International House. Faith Action is an agency in Greensboro, and part of our mission is to serve and advocate alongside newcomers each year, while also educating, connecting diverse communities together across lines of culture and faith. And though our name does say Faith Action, we are not faith-based, but more so we kind of value the in a lot of religions, there is a certain stranger to neighbor, or a mission to treat others with kindness. And so we kind of like to hone in on that, and that's part of our mission. But as a coordinator at Faith Action, I am connecting more with the receiving community, is what we call them. But I do want to go ahead and share the services that we do offer at Faith Action. So as I said earlier, we do have kind of three pillars, which is to serve, educate, and connect. As far as services go, we do have food, diapers, hygiene related items at the house that we prepare for families and individuals who may be in need. So if you need any of those items, feel free to please contact me. I'll leave my contact after I go through everything. But we do have food boxes and hygiene items that we prepare together every week, and that goes out to community members. We also have health and mental health referrals. We do have a congregational nurse program at Faith Action as well. Our nurse is Nurse Victoria, and she's wonderful, and she can help with kind of not necessarily diagnoses per se, but just ensure that clients have the resources that they need if they have certain medical conditions, to be able to access services that are affordable, safe, and within kind of the domain of their abilities. We also have a DOJ legal representative named Jose, and he is part of our legal aid and mostly deals with DACA cases. As you may have heard, DACA is being protected, and a federal judge did rule that DACA can stay. So we are currently opening up to receiving DACA cases. So if you know of anyone that might need support with this, please, again, feel free to contact me. We've also had backpacks and holiday toy drives. We actually just had our holiday toy drive this past week, and it was a really awesome time. We had a little drive-through so families could go around the house and pick up gifts. And then I think as far as services go, we may be best known for our community ID program. So it was created 7 years ago, and partly as a reaction to state and federal government not allowing driver's license to be issued to undocumented folks or folks with limited status. So this ID is a community ID, and it does have kind of a trust amongst all sectors that need to be involved. But I want to emphasize that this is not a government ID, this is a community ID, to give folks a sense of belonging, a sense of community, a sense of home with where they are. And as far as education goes, we do have trainings for both receiving communities. So we have an Immigration 101, a Serving, Loving, and Protecting trainings for folks to be able to better advocate and serve alongside their newcomer communities. We've also pre-COVID did detention visits with an organization called it's called Find, and we would go to the detention centers in Lumpkin. So if you're curious about that, the group also just recently published a book called Making Our Way to Lumpkin, and it's at Scuppernong as well as Amazon, but that's just something that we have also done. We've also done a Unity Walk, but this year we converted it to a Unity Drive. And then as far as connecting goes, we have a Stranger to Neighbor program that encourages different congregations, theologically diverse congregations, to come together and build trust and understanding and cooperation. And so we've had we've had programs that include a predominantly evangelical Latinx congregation with a Jewish Reform congregation, and they held activities together to better get to know each other as neighbors. So a lot of our programming does revolve around community building and just ensuring that communities know each other, respect each other, are aware of each other. But again, if you have any questions or any kinds of interest in any of these things, we're always happy to have volunteers or talk to community members who want to collaborate. But that's all that I have, Leanna, as far as Faith Action goes. And I'm not quite sure if Andrew wants me to touch on the art scholarship, but that's also something that I can do later on
Why don't you
if we
touch
want
on
to pass
that?
the ball to the next. Sure. Is it okay to share the news, Andrew?
Yes, it was in the
Yeah.
newspaper. It was in the newspaper today,
Okay.
so it's public
Sorry.
information.
So I might be okay. Sorry, my audio is so laggy, but I'm gonna go ahead and start talking, and if it gets too bad, please feel free to just unmute me, to mute me. But I have been working with Andrew as well as other community members, including an author named Harina, local artists like Sachi and Sue, as well as a very, very prestigious, I don't know what the right word is, but artists that have a lot of reputation in our communities for an art scholarship, an art fellowship, funding towards an art program that would kind of combine intergenerational artistry with kind of this new, younger versions of artistry that is expressed through a lot of the youth. And we actually just recently found out that we received funding. So we have some funding towards a festival is our dream, but the ideas are still kind of in the works. And I think what's important for us that communities and folks and individuals who want to be represented in this art program and this idea can be represented and have a space at the table. So again, this is very exciting and an opportunity for Montagnard folks and folks that maybe have been underrepresented, marginalized, not given the opportunity to showcase their art because of the different systems that exist, to be able to have a space to showcase their identities, their thoughts, their creativity in an accepting and safe space. So I'm feeling very grateful for all of the love that we got from our application and to be able to receive funding. And if there's anything that I missed, Andrew, please feel free to add to it. I know I kind of rambled, but thank you to MDA and Leanna and Ha and all the friends over there for giving me the space to share about my work at Faith Action and also the exciting arts grant that is coming up. And
Thank you.
that's basically it.
Thank you. Appreciate
Thank
it.
you.
And then so we've been referring some people, community members, to Phoen's agency, and to hope to continue our work together in the future. Next, I have Pinh and Vung. Would you guys like to take it since you're from the same agency and just share what you guys do at your agency and the resources you have?
I can go, and then Pinh, you can jump in if you have anything. So again, my name is Vung Kasur. I am the Refugee Health Coordinator at CNNC, UNCG, working with Immigrant Health Access Project, also known as IHAB. With IHAB, we connect our clients, community members with healthcare services and any healthcare related needs, including established care with the clinics and or provider, help with financial assistance, assist with applying Medicaid and or Orange cards, and anything else that has to do with health needs. So we do a lot of that. We also connect our clients to different resources available depending on their needs. And that is that. For me personally, recently I have just returned to work because I was on maternity leave for a while, so not so much update on my end. But I do want to say that I am very happy to have Pinh joining our IHAB team as a community health worker. We will also have an intern from UNCG joining the team in January. She is also a Montagnard and speak Rade. So we will have 2 Jarai speakers and 1 Rade. This is very exciting news for the team as well as for me personally, because after 3 years, I have been the only Montagnard with the team. So I'm very excited, and I would like to see, what we can do and work as a team. And Pinh, you can share anything else you want.
Hi everybody, my name is Pinh Mayun. I am really working close with Vương Kasar, which I really love it. I just started maybe 2 months ago as a community health worker. So we do a lot with application, like Vương mentioned, for Medicare, Medicaid, Orange Card, some assistant application as well. So we do a lot of follow-up with those and other appointment for their other appointment. So we do have like flu shot that organized by CNNC tomorrow. Do you have the address, Vương, if for the flu shot clinic free?
Yes, I do. I can share it on the chat.
Yeah. And as well, I don't know what else. I think you mentioned all of that. But for other job that I do as a part-time as well with the Mustard Seed community, which we do a lot of outreach with patient COVID in our community, which is really needed, and especially with food and explaining to them like how important the isolation quarantine during this time. So just try to care for other and our own family as well. So I think that's all from me. I can give if you can have question or need to contact, I can give my work phone number or even the email too in the group chat if any one of you guys need. That's it. Thank you.
Yeah. So thank you so much. Drop your email on the chat. So since you're kind of new to the organization, so people will have your information as well. So Phương is not going to be able to join us due to some hospital appointment. So Andrew is just going to share a little bit of information about her and the work that she does. Andrew, you're there? Yeah.
This is what she's written. She says, "Hello, everyone. My name is Phương Elena Roland. Currently, I'm working with the Community Care of North Carolina. I was hired as a contact tracer in the beginning of June. I was working with Forsyth County for a little bit before being transferred to Guilford County. As a contact tracer, our role is to conduct phone calls, interview with contacts, monitoring, following up with them for 14 days, and to support and assist anything they need in terms of food, financial, and testing sites. The resources that we are using to assist is based on what Guilford County has provided for us. For instance, if they are in need of some supports that tracers are not able to help, we task it to our leads, and the lead will take it from there. They will connect with people in the community who can help them to get the right support that they need. And also, if Dr. M can pay attention to this too as well, because maybe she can also help people to understand what are the protocols when people are being traced and if they need help and so on. So to continue here from what Phương is saying, in the beginning of October, the local health department needed case investigators or CIs who could help with them the positive cases. I was selected and was trained to become a CI and started to work with the local health department until now. As a CI, in my CI role, we conduct the phone call interviews with the positive cases to collect as much information as we can for our purposes. Then we sent the patients isolation order letters and work notes if they need for work and school. For positive cases, we are following up with them for 10 days and assisting whatever they need in terms of food, financial, and so on. One of the important things is we also are tracing for the contacts that the positive persons might have come in close contact with. How we do it is that we collect the contact information, the name, phone number, email address, and so on from the positive cases that they have identified for us, and then we enter them into the CCTO tool for tracers to follow up with. For the resources, we share the same resources as contact tracers are using.
And then one of the things they're trying to do, and they've built this around the contact tracing system that they've had around HIV in the past. So it's a similar method. And once you've been positive, they contact you, then go through the process and going through your networks and who you've been in contact with, getting all that information, and then they're notifying these individuals and their recommendations made. One of which is you've been in contact with someone who's tested positive, you might want to get tested, et cetera, et cetera. And then, so it's a whole network of contact tracing.
So just to be clear, Pun and Sharon, like if somebody we know in say the Monsignor community has tested positive, like we don't have them contact Pun or Fung, like they're going to be referred, right?
They're going to be contacted. The thing is, once you go into the testing,
but we don't do anything.
You don't have to. No, this information is, all this data is collected, and there's their confidentiality issues and what have you. So all that information is collected, and then the contact tracers then do the follow up.
Yeah.
Right. So for me, it's just understanding the process, but I, in my capacity at MDA, would not have anything to do with that, or most of us wouldn't.
You can make recommendation if you've heard somebody got contact. So you can make recommendations, but once they have a positive test, then they follow the trail.
Okay, thanks.
Yeah. And Andrew, also, there is a free training through the Johns Hopkins University. If you want to do the training, it's 7 hours training. I can send you the link. It's really good training. We've learned a lot.
It really is.
Yeah. So, we are in the holiday season. Christmas is big in our Monsignor community. And in the past, Christmas is where a lot of gathering happening and stuff like that. So I wanted Leela to, just from her experiences, to just talk about safety tip for the gathering. If people do get together during the holiday season. Leela, you good to go? Are you there? I don't see you on my screen. Oh, there you are.
I'm here.
Okay.
Really, with the holidays here and Christmas right around the corner this upcoming week, it's really imperative that people will take precautions. COVID is at most, it's rampant even more now that it's also not just flu season, pneumonia, but also COVID. It's to a point where I'm seeing it at increase at both facilities that I work with, at Alamance Regional and at Duke. Green Valley in Greensboro is actually overflowing, where at Alamance we're having to take COVID patients. Before, it used to not be like that until probably a few weeks ago. So if you gather, please wear a mask. Please stay 6 feet away. Wash your hands frequently. Not just use the bacterial, antibacterial sanitizer. Please wash your hands, meaning soap, water, 15 seconds. Not just wash and then just go. No, 15 seconds. Say your ABCs, or sing happy birthday, warm water, and then paper towel. I highly recommend you not gather if need to. No more than 6 to 10 people within a household. Just recently, I've seen several co-workers and family members. I actually had a family member pass away right after Thanksgiving with COVID. So it's real. Do not take it lightly. So if you're gonna gather, like I said, please take safety precautions, because I don't want anything to happen to anyone, and I don't want to, hear the news that something has happened to you. So, like I said, keep your distance, wash your hands. I really recommend not to gather, but no more than six to 10 people. I know with the churches, the traditions of having the annual nativity scenes and, the Christmas parties, etc. But until this pandemic is over and everyone's vaccinated. Duke just rolled out with the vaccines with, you know, some of my coworkers have already signed, like right now it's like a lottery ticket. You basically sign a waiver, they'll pick you if they have enough vaccines. So it's until all this is kind of, you know, kind of over, I just want everyone to just be safe for the time being.
Thank you, Leila, for sharing that tip.
Leanna, can I just ask a quick question to Leila?
Yes. Go ahead.
Hey, Leila, so since you're in the health field and you see this stuff happening every day, do you have any like fear, suspicions, or worries about the vaccine? Like there's a lot of rumors and, you know, that's going to be a big issue. So could you say something about that?
So you're looking at a person who really doesn't want to get it. Duke did give us the option. They didn't mandate us, all their faculty and their staff, especially the frontline workers, to get the vaccine. So those that are getting it right now are voluntary. And those that want to get it later, or they'll see what the outcome is right now, because it's still in phase 2. When it hits phase 3, after, you know, there's proof that people have become immune to the virus, that such, you know, like the flu, for instance, but they revamp the flu vaccine every year based on the strand prior to. So they're just testing the waters per se. So I'll let you know when I actually get mine. Right now, the last email I got was it's not mandated yet.
But you don't think there's like microchips and stuff, right? Like there's some sort of, no, but like I'm just telling you the stuff that we see.
Yeah,
Do you believe in that?
I've heard the rumors about the microchips and us being, you know, monitored, et cetera, et cetera. No microchips, no microchips. No, we won't be zombies. But, you know, right now it's just in phase 2. You know, with any type of research, there's 3 phases. It's in phase 2. Once we get out of phase 2 and we see what the numbers, the stats are, then we'll move to phase 3. That's with not just Duke, but any other institution that's also administering it. And I think Hopkins is another one. I think Baylor, and then also Emory. Those are the ones that I know so far. And then UNC just got theirs. Also, with me being a student with the Family Nurse Practitioner program there, we're actually trying to give more, like having more COVID tests available to the underpopulated, such as the migrant workers and the immigrant population. So if I know more about that, I'll definitely let Leanna or I know. So yeah.
Thank you, Leila. So since we're on the vaccine topic, our last 2 people is Carolyn and Laura. If they would like to share any update on the vaccine, just or talk more, who will get it first and how, etc., etc.
Okay. I already got a phone call from the pastor at my church wanting to know when they could get it. And so I'm like, oh, geez, we're still just now getting the vaccine for the, you know, the healthcare, the frontline people. So I'm glad that there's interest and that they're anxious to get the information. And see, my part of my presentation was to tell y'all that I really feel like it's safe. You know, I know that we're not that far into it, but so far out, I think there's like 70,000 people in the trials, and the side effects from it are very similar to the flu side effects. The vaccine was manufactured just like the flu vaccine. Montagnard people get flu shots all the time, and so, you know, I think we need to let them know that their reactions are just going to be very similar. For maybe 24 to 48 hours, they might feel tired. They could possibly have, well, probably a sore arm, maybe some little fever for a day or 2, but it should, you know, be very similar. But they need to know too that this one is a 2-dose vaccine. So you have to get, depending on which manufacturer, you get one. If it's Pfizer, it's 3 weeks later, and if it's the Moderna, whatever it is, it's 4 weeks. But we can't go off site with any of this anytime in the near future because of all the refrigeration and, you know, the process, the reporting, the tracking of the vaccine, and it's just too complicated at this point. Cone has offered it to their nursing, the medical staff, and I did sign up for it, but I'm not in phase 1 or in, you know, the high priority. So I'm looking forward to being able to get it. I think the other thing the folks need to know is that right now it's only approved for people 16 and up. They are doing some studies in 12-year-olds and up, but eventually I'm sure we'll have vaccine for the children as well. I think right now people just need to be patient and know that it's coming, but it's, you know, it's in different tiers, and at some point there'll be enough of it. One prediction I heard was maybe 6 months that there would be enough vaccine for anybody that wants it. But up to that point, you know, it'll be distributed according to who needs it the most.
Thank you. Can Laura explain the different tier, or do you have the information just so people know what the different tiers mean?
Yes. So I think, you know, Leila mentioned this as well, like the healthcare workers that are on the front lines, and Carolyn just said this, you know, the ones who are working with COVID patients, they are getting the vaccine first. So I know that they gave it at Cone Health today, and, you know, they had a video on our internal webpage showing the first people getting it. So the people at Green Valley, the old women's hospital, the people working in the COVID hospital get it first, the people working in the ICUs, the emergency departments. So those are the people that are prioritized. We do know that there's a plan for long-term care workers and the people who work in the long-term care facilities and the people who live in long-term care facilities. So we know that that is a priority. And like Carolyn, I'm not in the priority, the first wave. So I'll get it maybe in the second or third wave. I'm kind of expecting January to get the vaccine. But I appreciate what Andrew said about no fake news about this. We really want, you know, we want to be present at community forums and to really be able to offer the real story and be able to, as best we can, explain how the vaccine was able to be manufactured so quickly, because it's not a live virus, right, that we had to wait for, that this is actually a messenger RNA. And so it was able to be manufactured much more quickly. And I don't myself understand the reasons why the Moderna one can be in a regular refrigerator and the Pfizer one has to be in such a low temperature freezer. But I just want to help people feel comfortable taking these vaccines.
Thank you.
Another thing, you know, we've heard everybody's talking about going to Walgreens and CVS, which do have contracts to get the vaccine, but the first phase of their vaccine is going to be going to the nursing homes, people in long-term care. So it's not like you can just walk into Walgreens or CVS next week and get your shot. So that's something else people need to understand. Be patient. I said that once, but I'll say it again.
Yeah, thank you so much for sharing that information. Do we have any other agency updates? Dawn or other people, do you have anything to share from your agencies? Okay, or do we have any more questions that we have for the different speaker for tonight?
Hey, Liana, I might just mention that COVID testing, people are still able to register through you, and you're able to register through me to get COVID tests. But it is also on the website now that because of the cold temperatures, it's now by appointment. And so it's actually on the website that you can go on there and select your time that you want to get a COVID test. So either way, people can still register through you, or and you and I can work together, and helped us with that, or they can go online and do it, self-serve if that's more convenient.
Okay, sounds good. Thank you.
Can you say what the turnaround time is for the testing results at this point?
So if you go for a test, they'll tell you it's 5 to 7 days. It's coming back faster than that, but they're telling people that because I think they don't want to overpromise in case the labs become overwhelmed.
I went for a testing a while back. I went to the Green Valley one like 3 times, and it was super busy. I've never ever seen it was so busy. And then I ended up going to the Guilford Health Department, which it was like almost a 2-hour wait. So it's yeah. So I think that's one of the reasons, like, yes. But I got my result pretty fast. So they always tell you like the 5 to 7 days for the results. Any other question?
I have question.
Okay.
When I went to hospital, they test me right away. I have a result right away. How was that? Is that true or just fake?
Carolyn or Laura, you have, or Leela, the healthcare people?
You probably got the rapid. There's 2 versions of it. There's the rapid, and there's the one that they send off that usually takes anywhere between 48 to over 72 hours as far as the turnaround. So you probably got the rapid. The rapid usually takes less than an hour to get back with the results. Juke does the rapid. Alamance does the rapid too in the emergency room. It's just to ensure. So that's probably why you got your results so quickly.
Yeah, just an hour.
Yeah, you got the rapid.
Okay. I'm negative though.
Good to hear.
Good to know.
But you still have to isolate yourself for a little bit more, even though you're negative.
Yeah, still stay 14 days away.
Any other question or comments?
Leanna,
yes.
I'm as part of the COVID-19 Trials Network. I wanted to just make a few points that the community needs to be aware of. Is in terms of vaccine, that they're trying to make sure the community is engaged and understand why. So in addition to the myths about the vaccine, they're going to be collecting a lot of information, and that can raise some concerns. And so they want metric-driven approaches so that they can assess the effectiveness of the rollout. So one of the things they're going to do is take a lot of information, and have this in what is called a statewide registry. And people need to know this up front. So we've written an extensive 3-page letter with details, and that community must be included all the time. So this is another piece of the message that the community has to get, that there's a lot of data that's going to be collected. And folks are going to want to know why. Why are you taking all this information? And it is not to keep tabs on you by the government, but it's to kind of really have solid data about how this vaccine, a better understanding of how it works. They're going to need a lot of biometric information from folks. They're going to need some health histories, so that we can know that if you've got hypertension and you get vaccinated, did it help you, protect you, or did it make your hypertension situation worse? So I wanted to stress that piece, because that is not being said a lot. More people are asking a lot about the vaccine itself, but once you go to get vaccinated, there's a lot of information they're going to collect. The promise of your confidentiality, keeping it safe. But really, this is to better understand. And particularly folks who are belonging to these different ethnic groups as they go down the list, and different pre-existing conditions. So that's messaging that you're gonna have to add in anything you're doing in outreach to the community. You're gonna add that part too. And emphasize each time you get the vaccine, they're collecting information too, so, or verifying. So it's an important piece.
All right. I was looking for my microphone button. Thank you, Dr. Morrison. Isil, do you have anything else to add before we end the meeting?
No, I think the meeting was very interesting. I'm very proud. I'm very happy about that. And I would like to say thank you to everyone before we adjourn. May you all have a Merry Christmas and Happy New Year. That's all. But be careful when you enjoy your holiday. Don't gather, gathering together more than 10 people, you know, or closer. Keep social distancing, mask, glove, all the way.
Yes.
Everyone.
Yes, please help share the information and with people, community members that you run into. So we appreciate. If you guys have any other question or anything like that, or how to connect with one of our community member speaker, feel free to send me or Han email, and we'll connect you all with them. So we have people who speak Jirai, Rade, Benong, and then most of the people that were on the calls also speak Vietnamese, so they also can communicate with people in the Kahar tribes or Banhar tribes. So thank you so much, you guys. Have a good evening, and thank you for joining us this evening, and we'll see you later.